Sir, good morning. Are you okay?
No, I've had super bad stomach cramps.
Okay, here, we'll get you a seat, and then you can tell me
I feel so weak.
anything else that might be going on.
Okay.
So you said you have bad stomach cramps. Do you have any other symptoms?
I've been really thirsty. Oh, I'm so thirsty. And I've been really weak, and I've been peeing a lot.
Okay. Alright, so any other health issues or symptoms that you've been exhibiting?
Yeah, I'm a type 1 diabetic, and I take insulin every day. So.
Okay, perfect. Well, let me make a note of that, and we'll get you dressed up in a robe, and the doctor will be in here, and we'll take a look at you and get you healthy, okay?
Sounds good.
Good afternoon, Dr. Tremblay.
Good afternoon, Darcy.
So I was just in room 1 looking at our patient, Dan Preston. He came in exhibiting some signs and symptoms such as general weakness. He was really complaining of stomach cramps. He had excessive thirst, and he said he had frequent urination recently. So.
Okay, have you done any other tests on Mr. Preston?
Yeah, I did a quick head to toe on Mr. Preston. There's no significant findings, nothing else I could find. I also did a quick urine test for ketone bodies, and the stick came back purple, which is indicative of high ketones.
Okay.
And I also did a CBG on him, and that came back at 25, so that's very high.
Okay, based on the signs and symptoms and the lab findings you gave me, I think Mr. Preston is in a state of diabetic ketoacidosis, so we should go to his room and talk to him about the treatment, okay?
Okay.
Hello, Mr. Preston. My name is Dr. Tremblay. Based on the findings that your nurse gave to me, it's indicative of diabetic ketoacidosis.
What's that?
Insulin binds to the cell membrane, allowing glucose to cross and to be used as a source of energy, and it also inhibits the process of lipolysis. In patients with DKA, insulin is not present and the body goes into a state of starvation and burns fat for energy. This results in the production of ketone bodies and induces a state of acidosis.
Okay, Darcy, so what do you think the treatment options would be for Mr. Preston here?
Well, Dr. Tremblay, I think one of the first things we should probably do is to get him some normal saline going for fluid replacement to try to...
That's a great idea, to dilute his blood.
Yeah,
because
exactly.
it's very high in glucose. Yep.
Yeah, and also get some short-acting insulin to get his CBG level back down, because we want Mr. Preston to be nice and healthy to get out here. So, Mr. Preston, how are you feeling now?
A lot better.
A lot better? Awesome.
Oh, yeah.
Okay, well, now we're going to try to get you out of here now that you're looking a little bit better now. But before we head out, I just want to go over some health teachings with you and some ways to maintain your diabetes.
Right.
So one of the main things you're going to want to do is you're going to want to make sure to do your CBG test before every meal to make sure that your blood glucose is at an acceptable level. And when it's out of the range that it should be, you're really going to want to make sure that you're taking your insulin, because that'll really help stop these symptoms that you're having and make you feel better when you do have an issue. And also, one of the other things is you're going to want to cut out foods that are high in sugars and that are high in carbs as well, especially your mojitos, because we both know you really like your mojitos. And one other thing that you're going to want to do too is just try to stay active and like do any like sort of activity, maybe 30 to 60 minutes a day if possible, and that'll really help your body just be able to maintain itself and to keep you in good shape. So let's get you all packed up and get you out of here and out of this greasy robe, and we'll be good to go.
Sounds good, thank you.
All right, no problem.